If you have heard of gout, you must already be aware that the most common symptom of this condition is joint pain. So if you are having severe pain in the joints, you are likely to be suffering from gout. But then, the same symptom is also a sign of many other joint diseases like osteoarthritis, rheumatoid arthritis, infective arthritis, or even injury. This is why it is not uncommon for patients with gout to get an incorrect or delayed diagnosis. This in turn prevents them from receiving the most appropriate treatment. A wrong diagnosis can obviously cause you to get treated for something you are not suffering from. And all this while, the actual condition you are having, which is gout, will be left untreated, allowing it to progress further until your joints are severely damaged. This is more likely to occur if you have not heard of gout, because in this case, the chances of you mistaking your symptoms to be due to any other form of arthritis are very high. This is why, whether it is joint pain or any other symptom, it is very important that you make the right diagnosis and know whether your symptoms are due to gout. For this, you need to be aware of the common symptoms of gout and the ways to differentiate them from other similar joint diseases. We are going to share with you the top 5 common warning signs of gout to make the right diagnosis on whether you are having a gout flare or not. Number 1. Specific joint symptoms. If you have symptoms like extreme pain in the joints along with swelling, warmth, and redness of the skin, you might be suffering from gout. These are the classic signs of gout. The specific sign that will help you differentiate gout from other conditions is the pain caused due to gout often comes suddenly and becomes extremely severe within a few minutes. Also, joint pain caused due to osteoarthritis or rheumatoid arthritis is usually dull and progressive. It is often accompanied by stiffness rather than the redness or warmth of the skin. So if you are experiencing attacks of joint pain that come up abruptly and become worse rapidly, usually accompanied by swelling, redness, and warmth of the skin, you might be having gout. Also, the swelling and redness caused due to gout are localized, which means you will notice these signs around the affected joint. The joint may also become very tender to touch to the extent that even the touch of a soft cloth will make the pain worse. However, these symptoms may exist even if you have joint pain due to trauma or injury. But the lack of history of trauma will help you rule out these causes of joint pain and make the possible diagnosis of gout. Moreover, the diagnosis is more likely to be gout if you are below 60 years of age and not overweight, as against osteoarthritis, which generally affects older individuals, especially if they are obese. Additionally, the involvement of specific joints can also help you differentiate between these conditions. For example, if you have a pain in the great toe, it is more likely to be due to gout. Similarly, pain in the hip and knee joints is often due to osteoarthritis, while pain in the smaller joints like finger joints could be a sign of rheumatoid arthritis. Number 2. General symptoms. If the inflammation experienced during the flare-up of gout becomes very severe, you may develop general signs like fever along with other flu-like symptoms such as weakness and fatigue. These symptoms usually occur when the gout attack has affected 2 or more joints. Inflammation in 1 or more joints can cause fever and other flu-like symptoms, even due to other forms of arthritis, like rheumatoid arthritis or infective arthritis. This is why, when joint pain occurs with fever, the diagnosis can be particularly challenging. The clinical evaluation of your symptoms and the results of lab testing, like an elevated uric acid level, can be helpful in these cases for confirming the diagnosis of gout. Number 3. Other joint involvement. We discussed earlier that if you have pain in the toes, it is probably due to gout. However, this does not mean gout affects only the joints in the toes. This condition can also affect the other joints, such as the back and wrists. So if you have low back pain that comes and goes and is accompanied by fever, you might be having gout, especially if it does not respond to other treatments. Gout in the back usually affects the lower part of the spine, including the lumbar spine and the sacroiliac joint. The sacroiliac joint is a joint between the sacrum and the ilium on either side of the pelvis. If you have gout in these joints, you would experience repeated episodes of severe pain in the low back, usually with hip pain. The characteristic features of pain and accompanying symptoms, in this case, will be similar to that occurring due to gout in the toe joints. So, it is best to be watchful of the specific features of back pain, especially with regard to how rapidly the pain becomes worse, to know whether you have gout. If gout has affected your wrist joint, you may be having polyarticular gout, which means the rise in your uric acid level has started affecting multiple joints in your body. This is definitely not a good sign. It also points to the need to seek immediate corrective measures to lower your uric acid levels. But pain only in the wrist joint is very rare in gout patients. If you have pain only in the wrist joint, an accurate gout diagnosis may become elusive. An ultrasound scan of the joints and aspiration of the fluid may be needed in such cases to arrive at a correct diagnosis. If wrist pain is due to gout, ultrasound will help to identify the areas where the excess uric acid has been deposited in the form of crystals. Aspiration involves drawing out excess fluid from the joint using a needle and syringe. The fluid can then be sent to a laboratory to detect the presence of uric acid crystals. So even if you do not have joint pain, especially in the toes, you might still be having gout. It is important to bear in mind that gout can also affect other joints like the back and the wrist so that you do not miss the diagnosis or end up seeking improper treatments. Number 4. Tophi. Tophi are bumps under the skin. If you notice tophi under the skin of the affected joint, it can be a sign of gout. Gout patients develop tophi when the excess uric acid crystals get collected together, forming chalky nodules of varying sizes. Tophi usually appear on the joints of the toes, knuckles, elbows, and knees. Tophi are common in patients who have had gout for several years. These bumps can be felt and even seen. Tophi are usually painless yet annoying because they tend to interfere while moving the affected joint, making it difficult for you to perform routine activities. If you have tophi, it indicates the treatment you are receiving is incorrect or that your gout has been left untreated or undertreated for several years. But these tophi are likely to dissolve and even disappear completely if you start taking the right treatment aimed at lowering uric acid levels in your blood. Along with tophi, you will also observe the peeling of the overlying skin. Sometimes, the skin covering the affected joint also becomes itchy and flaky. Keeping a watch on how your symptoms progress and the additional symptoms that you develop can be helpful for making the diagnosis of gout. Number 5. Kidney stones. What makes kidney stones a likely sign that you may be having gout is the similar underlying factor that causes both these conditions. Gout occurs when there is too much uric acid in the blood. The same abnormality can also make you vulnerable to developing kidney stones. The primary function of the kidneys is to eliminate excess toxins and byproducts like uric acid from the body via urine. If the kidneys are not doing their job properly, or if your body is producing too much uric acid crystals would begin to build up, forming both kidney stones and gout. This means if you have chronic kidney disease, you are more likely to have gout. So having kidney stones can be a sign of gout and vice versa. Gout, unlike most other joint diseases, has a few characteristic symptoms. If you are experiencing any of these symptoms, you must check your uric acid level to confirm or rule out the diagnosis of gout. You should also be watchful of how the attacks of joint pain come up and progress and the various symptoms accompanying the pain to be able to make the correct diagnosis and receive the best treatment. If you've enjoyed this video and it helped you learn more about gout, please be sure to subscribe to our channel and click the notification bell so that each week we release a brand new life-saving video, you'll get notified right away. Till next time.